I think we'll get started. And first, I want to welcome you and say good afternoon. Thank you for joining the fourth session of the Childhood Cancer Prevention Initiative, or CCPI, webinar series on breaking the mold on cancer care and prevention. My name is Ann Robertson, and I am one of the co-founders of this initiative, as well as Toxic-Free Future for Our Children. I'm excited to introduce you to each of the panelists, as well as give you an overview and update on the CCPI report a year after its initial release last September. But first, I'd like to give you a quick background on CCPI. It was created originally to build a bridge between the cancer cure and cancer prevention worlds, and to develop a cross-sector strategy for prevention, as so much of the work involved in cancer cure and prevention is siloed and was siloed. And there was a definite need to break down those silos and connect a broad array of stakeholders, including environmental health scientists and researchers, health professionals, business leaders, policy experts, and advocates. For years, I was engaged with the cancer and chronic disease prevention world and had helped to fund studies and was doing research connecting the environmental links to pediatric cancer and other serious childhood chronic diseases. And it was during this time that I was introduced to Richard Platkin, the founder of the Max Cure Foundation, a pediatric cancer foundation that was largely focused on curing pediatric cancer. It was apparent from our very first meeting that Richard and I were political opposites. He was a conservative Republican, and I'm a progressive Democrat. But we found common ground on our mutual concern for the health and well-being of our children and our grandchildren. And after spending several years, almost 7 years to be exact, educating Richard on the environmental links to pediatric cancer, we decided it was time to connect these two siloed worlds and create this initiative. Sadly, Richard passed away 2 years ago, so he is not here to see this initiative come to life and take off. But it is my hope that his legacy of reaching across the political aisle, going outside his comfort zone, to better understand and eventually embrace the environmental links to pediatric cancer will live on and will be a lasting legacy. We both agreed that working together on this initiative would help build much needed bipartisan bridges, now more than ever. But now for just a few of the updates since the initial 2020 report was released. Researchers reported that incidence rates of cancer among those under the age of 20 had increased by 34% from 1975 to 2017. Sadly, today this upward trend continues. New data from 2018 from the National Cancer Institute's Surveillance, Epidemiologic End Results, or SEER, program shows that incidence rates since 1975 have increased by 41%, annual percentage of 0.8%. We don't know what the data will say for 2021, and we won't know that for probably 3 more years. But the trend doesn't look good for childhood cancers in this country. Over the last year, since the report was released, scientific research has validated the primary findings in that report. Recent meta-analysis data confirms that exposure to pesticide increases the risk of childhood leukemia, especially if women are exposed during pregnancy. Recent studies also reveal that living close to plant nurseries may also increase risk of childhood cancer, raising the specter of exposure to pesticide drift as a cause of childhood leukemia. In addition, studies continue to document concerns related to the increased risk of childhood leukemia associated with air pollutants, including outdoor air pollutants, and in particular, children and families living or near petroleum and petrochemical facilities are at greatest risk. But we all have indoor air pollutants in our home that are also linked to pediatric cancer. And the topic of this webinar is breaking the mold on cancer care and prevention. And you will hear from three amazing individuals who have each broken the mold in their respective careers. They have each taken risks and challenged conventional wisdom in their field. And as a result, are forging new paths and direction that will not only inspire others in their fields, but also support the mission of CCPI of charting a course of action that will prevent pediatric cancer and protect children's health and well-being for generations to come. My first panelist is Dr. Nasha Winters. She is not only a pediatric cancer survivor, she is also an integrative oncologist and is a global healthcare authority, best-selling author in the field of integrative cancer care and research, consulting with physicians around the globe. She has educated hundreds of professionals in the clinical use of mistletoe and has created robust educational programs for both healthcare institutions and the public on incorporating vetted integrative cancer therapies in cancer care to enhance outcomes. Dr. Winters is currently focused on opening the Metabolic Terrain Institute of Health, the first ever comprehensive metabolic oncology hospital and research institute where the best at standard care has to offer, and the most advanced integrative therapies will be offered. This facility will be in a residential setting on a gorgeous campus against a backdrop of regenerative farming, EMF mitigation, and a retreat, as well as a state-of-the-art medical technology and data collection and evaluation to improve patient outcomes. Nasha?
Wow. Thank you so much, Anne, for letting me take part of this amazing panel discussion. I'm honored to be among some of my peers and colleagues here that are bringing some amazing and hopeful changes to the world. So I look forward to hearing from Joan and Michelle and others as well. And so you wanted us to share a little bit about how we all ended up on this panel together today. And my goodness, I was thinking about this in the last couple of days as I was preparing for this conversation, to realize that next month will mark 30 years since I was diagnosed with terminal cancer. And my journey started at the ripe young age of 19. So I was considered a pediatric oncology patient. And that diagnosis was a terminal one. I was not expected to see the end of my 20th year on this planet. And here it is in a couple of days, I'll be reaching my 50th birthday and getting to celebrate that with all of you here as I am hopeful for what is on the horizon of changing these outcomes. So given that terminal diagnosis almost 30 years ago is what launched me onto a path of not only trying to survive, but learning to thrive. And I wanted to explore why cancer took up residence in my body, which has now influenced the way I have cared for myself for all of these years and decades, along with tens of thousands of other patients. I am no longer in private practice, but I do spend my time educating researchers, physicians, biotech companies, medical companies, and patient advocates from all over the world on how to apply a methodology that I've mastered, this concept of test, assess, address, and don't guess. This educational platform is planting seeds of change all over the world to create a new model of healthcare in general, but with cancer in particular. I'm one of 4 founders for the Metabolic Terrain Group, which consists of 3 distinct entities. So there's the Dr. Nasha Inc., which is where I do all my consulting, writing, and teaching projects today. There is the Metabolic Terrain Omics, or MT Omics, which is the technology platform in which we are gathering all of this critical data to understand the why, where we do the test and assess aspects of this so we can evaluate the direct and precise means of personalization of patient care and prevention, and inform medical decisions while impacting and improving patient outcomes, and hopefully medical systems worldwide. And then finally, the big dream and vision that started percolating within me nearly 29 years ago of this concept of the Metabolic Institute of Health was the sort of birth of this idea of a not-for-profit residential integrative oncology hospital and research institute, where the best, as you noted, of both worlds of standard of care and integrated medicine can come together under one roof so that we're not running around trying to piecemeal together our care. Specifically with oncology, we hope to have a pediatric oncology wing of this hospital. As we were talking before this visit today, parents who choose to maybe try something different than standard of care, or who have been failed by standard of care, if they opt out of standard of care, are actually not only faced with the threat of their child's well-being, but of the child actually being taken out of their home. And so I've seen that time and again of parents needing to actually uproot their lives and move their children to other states or other parts of the world in order to have access to health care that may not be part of the standard of care of the radiation, chemotherapy, targeted therapies, surgeries that are the only offerings. And so this model of an integrative approach needs to be made more available to our pediatric communities as well, without threat to the parents losing their children, custody-wise, but also their lives when their offerings are so limited. So being a research institute as well gives parents that right to try act, which is a new bill that passed a couple of years ago that allows folks to start to look at research-informed, not just evidence-based medical approaches to their healthcare. So this hospital and research institute is taking form in Southeast Arizona as a model for what cancer care should be, whether you're a pediatric or an adult person facing cancer, or someone with high risk trying to prevent cancer, or someone simply trying to clean up their terrain after having cancer and prevent a recurrence, or to live with a manageable disease process, which we have made cancer made cancer more about today than ever before. This should be the model around the world. So at this very moment, you asked about how am I actually using this in my practice, in my field today. We have 68 physicians trained or in training to learn this terrain-centric metabolic approach to cancer. We have 100 patient advocates currently enrolled in our terrain advocacy program. And we have a next physician training cohort starting on October 5th, 2021. We are actively building partnerships and collaborations with researchers and biotech companies and medical and academic institutions around the world who are all committed to changing the limitations of the current model of cancer care. We are seeking philanthropic donations to acquire the land and start the build out of this hospital. We continue to take donations for grants to help patients access integrative oncology, informed integrative oncology now with one of our trained physicians. And we're also seeking investment for our data platform to aid in the research and practice management that will ultimately be the driving force of this vision. And so the two complaints I hear about integrative oncology is that number one, it's simply too expensive and out of reach for most people. It's mostly out of pocket. And those to actually do something beyond standard of care. And number two, that there's no data or research to evaluate whether this approach actually improves outcomes. So this is precisely what the MT group and the MTI of Health are planning on doing, that despite my own data collection of nearly 3 decades and now dozens of other clinicians collecting their own and thousands of patients being their own N of 1, we now have a platform to collect and analyze all these data points to inform clinical decisions and ultimately reshape our access to a more inclusive and integrative approach to oncology care and prevention. So that's what we're up to.
Anne, you're muted.
Sorry. Yep. Didn't realize that. Yeah. Well, that's quite a lot, Nasha. And it's amazing. Your journey has just, inspired me and so many others. So now another just incredible individual I met who just a couple of years ago, and the work she has done in preventing cancer and with her work at the Helen R. Walton Center for Childhood Enrichment. So let me introduce Michelle Barnes. She is the executive director of the Helen R. Walton Center for Children's Enrichment. Excuse me, the Helen R. Walton Children's Enrichment Center. She's been there since 2000. She holds a degree in business, early childhood education, a Master of Ed in early childhood leadership. And it was during this time she supported the field of early childhood education by collaborating with Arkansas State University, the Department of Human Services, in roles such as consultant, trainer, and assessor. Additionally, she served on the Arkansas Early Childhood Association Board, Invest Early Council, the Governor's Early Childhood Commission as well. She's been awarded the Women in Business Honoree in 2015 and has recently joined Eco-Healthy Childcare National Advisory Committee, Getting Ready for Baby National Advisory Committee, HeartSook Global Advisory Council, Arkansas Teach Advisory Panel, and Kids Safe Northwest Arkansas. Michelle, I am so honored to introduce you and tell the story of what you did when you became aware that three children in your center were diagnosed with cancer. So I will let you take it from here.
Fantastic. Well, first of all, thank you all for joining us this afternoon. It's been an honor to sit on this panel with Joan and Dr. Nasha Winters and Anne, of course. As we were thinking about this, we were discussing what our wake-up call was with regards to environmental toxins. And for us, we were in the process of designing a new campus, serving 250 children every day. And at that time, we had 2 children that were diagnosed with different forms of cancer. Both, ironically, were tested for hereditary causes. And it was determined that these were not hereditary, rather environmental driven. At that point, it caused the board of directors and myself to pause and think about, what does this really mean for our young children? And what can we do differently? So let me backtrack and share a little bit of a story of Grayson. In 2014, Grayson Schmidt was a 2-year-old participating in our program, and he was diagnosed with leukemia. He battled leukemia for several years, spending the good part of 3 years in Little Rock at Children's Hospital. Split family at this point, where mom was down in Little Rock and dad was in our immediate area with another child. So this was a very difficult time for this family. And so we started thinking about what could have led to this form of leukemia that Grayson was battling, and what could we do differently moving forward? So at that point, we had an opportunity to switch gears and identify an architect firm that actually had experience building healthier, actually it was healthier low-income housing in New York. And we piggybacked off that project and began to design the first of its kind healthy campus within early childhood education. With that in mind, we eliminated 6 major classes of chemicals, everything from PFAs to antimicrobials, solvents, certain metals, etc. And then we spent about 3 years researching children's products on the market that eliminated or did not include these chemicals in the product itself, down to the crayons that young children actually use in the classroom environment. So in our facility, what you're going to see is natural fiber carpet, no glues holding the carpet down, no plastic toys in the classrooms, We were very intentional with our thought process that we could minimize toxic exposure for these young children. So now that we have this healthy campus and we've been open for 2 years, the question is, what can we do next? How can we impact the early childhood community nationwide? With hundreds of thousands of centers and several million children spending 8 to 10 hours a day in a childcare setting, we realized we had a golden opportunity. We are in the process of starting a new initiative called Growing Up Healthy, with the idea that we can begin shifting policy. This would be in minimum licensing standards, as well as quality accreditation standards that would consider environmental health components. Again, having a greater reach. With this, just like Dr. Winters indicated, we also believe research is critical. So we will also be conducting evaluations of programs pre and post changes related to environmental health. So we're looking forward to that. Additionally, we'll be adding components around education, not just for the early childhood community, but for also parents, and giving them also a marketplace in which to purchase healthier products for their young children. So we're very excited that we have had the opportunity to think differently about a campus design and ways that we can impact millions of children across our nation. We will be partnering with agencies that have been working in this area for years that will help elevate the work around this within early childhood education. So once again, we're very appreciative of being here, and Anne, thank you for the opportunity to participate in today's panel.
Well, thank you, Michelle. And yeah, it is just amazing what you've done at the center, and worth everybody going to visit at some point. So, and hopefully we'll see them all over the country in the not too distant future. Now I'd like to introduce Joan Wagner. Joan and I have known each other for a number of years, probably the longest of any on the panel. And we've had quite a journey from the very beginning, that when I met Joan, where it was around an event in New York on this topic. So, but Joan is head of the client services for New York Life Investors. She's a senior director and head of client services for New York Life. She's responsible for managing all institutional client activity for the fixed income and private placements group. Formerly the director of marketing and client services at Ramius LLC, independent alternative investments firm. Prior to joining Ramius, she was director of marketing for Valeris Advisors, which was an independent investment advisory firm specializing in volatility management. Joan has, as you can see, has had a wide and vast career in the financial industry, services industry, and investment community. And she is also, though, has quite a unique story in that she is a mother of a pediatric cancer survivor. She has seen, I think, through that experience, she can tell much better than I, what it is like to be in that position and see your child. Fortunately, he is he's thriving and doing well. But as a result, she took a turn for a unique opportunity to look at the public health aspect. So she got her public health degree at Columbia during this time and learned quite a bit there, and serves on a wide variety of nonprofits, one of the co-founders of 100 Women in finance. Also Poetic, which is the Poetic Foundation, which is devoted to cancer or to cancer cure, and she can tell a little bit about that. But also a very interesting nonprofit called Ethos Farm Project, which is really, to me, too. So she bridges so many areas, and it's just with great honor and privilege to introduce you, Joan.
Thank you, Anne, very much. And thank you for the opportunity to be part of this webinar. And also, I feel it's quite an opportunity to serve with these other two panelists as well. So thank you all for that. As Anne mentioned, I am a mother of a pediatric cancer survivor. I have to say it was a total shock when I found out that my son had cancer. He had just turned 16 years old. He had no, evidence of being sick or not feeling well. He had actually had a physical in July and then blood work in August and was diagnosed in September. So of course I was surprised because the test results came back fine. His visit to the doctor was fine. And so it was definitely a shock, and it was very devastating. He was young, and I don't think that he realized what was going on. I think he was totally stunned. And he was going at the time to a private school in Connecticut. So we had to go up, make the long drive and get him and bring him home and get to see an oncologist as soon as possible, which, fortunately we were able to do. But the whole time, all he kept saying to me is, "Mom, I just want to go back to school. Please, I want to be with my friends. I want to be back in school." So it was really hard telling him that, this was going to be possibly a long road, but he has and always has had a good attitude. So during that time, I was encouraged to stay in, working. And as you heard from Anne, I spent most of my career, all of my career in finance and investments. And, this was kind of, I wanted to learn more about health and, helping my son. So after my son's treatment, his oncologist asked me if I would help her form a not-for-profit for this foundation to help children whose cancer was not cured with the initial protocol, and that, this would be for clinical trials to find therapies and other ways to treat the cancer that the child had. And I said yes. So I became the co-founder of the Poetic Foundation, which helps to fund the teams and institutions that can discover new cancer fighting technologies and treatments. And the mission is basically to support these investigators that work at the different hospitals to administer the clinical trials for children. And then hopefully, the research and the protocols that they come up with will help children and, conquer or help them become, go into remission. So I've been with that organization for a long time. I've worked with the doctors, and we support 10 hospitals. You would recognize them all. And I've learned so much about pediatric cancer and the treatments and the technologies. It's been an amazing experience for me. And I don't have a medical background. The master's in public health helps to some degree, but it's not the medical degree to understand some of the therapies. And they've given me books to read, but a lot of them are so technical, it's been difficult. And then recently, as Anne mentioned, I joined the Ethos Farm Project, which is a not-for-profit that promotes regenerative organic farming in a community in North Jersey, in Long Valley specifically. And so I just joined that organization, and they're also looking, other focuses are on next generation physician programs, because we feel that physicians are not given enough in nutrition. We want to try to train physicians to understand, more about nutrition as they go through medical school, and then also want to look into setting up a next generation farmers incubator program to get more young people involved in this regenerative organic farming. And currently the organization is doing ecosystem and carbon trials. So to plant native grasses to capture the carbon in the air. So they have this organization has a lot to focus on. So I find that beginning with a new organization as they go along this path is exciting, as I found with the Poetic Foundation. When I started, I think it's been 11 years since I've been involved in that. So even though I have a career in finance, I feel like I have a second job in, health and wellness. So, which I really enjoy. And especially that I had a child that had cancer and just, want to help him lead a healthy and good life. So thank you, Anne.
Oh, there we go. Whoops. You also played a very instrumental role in creating the 100 Women in Finance that started from a teeny little,
Yes.
way back, and now has grown to a really, really exciting, dynamic organization.
Yes.
Globally.
And in fact, I think that had something to do with my interest in health as well, because when I joined, I had gone to one of their events, and I had joined in the in the hedge fund industry. And I wanted to learn more about hedge funds so I could do my job well. And the event was not an educational event. It was to find people to help with a philanthropic event for NYU Cancer Institute in New York City. They were just building this institute, and they reached out to us because there were so many, it was a women's organization, and they wanted to see if we would help them, what kinds of things should be in the center? What can you do? What should we be doing? What should we implement in, the exam rooms and, the other rooms where people were waiting. So I was, quite surprised. I didn't think that, I was wondering, where is this going? But I became the head of sales for this philanthropic organization. And it was in New York City at Cipriani's. We raised $1 million. And with that gift, we were able to donate a stereotactic machine that does biopsies on the breast. And come to find out, like, so many of our members in the organization had experienced, either they had a family member that had breast cancer, they had a friend, and so many women came forward and said, thank you, I'll be very supportive of NYU Cancer Institute. And they implemented a lot of the suggestions we had. One in particular, I remember, was a store to house within the center to sell, scarves or wigs, so that you didn't have to run out, to a store and try to find these things. So it has evolved through the years of just being exposed to, just awareness of cancer and the impact on people and new therapies. So.
Well, great. Well, I thought now do more of like a roundtable discussion and ask a couple questions that you each can respond to. And then we'll have more of a general question. And if anybody has questions or that they'd like to put in the chat, that would be great. That would be probably the best way is to do that. But the first question is, as you have told your stories, you've each been affected by pediatric cancer in different ways. And as a result, you've each had a pretty big wake-up call about how toxic our world has become. So I'd love for you to describe, I know you've done some of that, but maybe in some more detail, you know, how your journey of affected you when you first kind of had that wake up call, you know, and said, wow, that was a, you know, big surprise. I think it was myself. I've had my wake up call and was pretty shocked. And then how did this change and alter your careers and or just take a different path as well? Anybody want to start? Yeah,
I'll jump in. You know, back in 1991, there was no Dr. Google, right? And so there were no resources. I had the Dewey Decimal System and microfiche for any of my research that was out there. And I also was at a small 4-year liberal arts school that was not highly funded. And so a lot of our books in the library were a bit antiquated. And I have to say that that was actually a lucky strike for me because I was able to read literature from people like Dr. Otto Warburg, 1920s Nobel Prize winner on mitochondria at the root of cancer, and read the work of Beauchamp, who was one of Pasteur's contemporaries who was understanding terrain versus infection causing illness. It was more of what that infection was landing in that was the cause of illness. And those were inspiring me. And then the work of people like Dr. Mina Bissell, who talked about the extracellular matrix and the terrain in her work in the 1980s. And in that time, I was also stumbling upon the work of people like Dr. Robert Ader, who was famous in his work of psychoneuroimmunology. And so it was sort of an accident at that time that I was stumbling upon the very things that are, I believe, the reason why I'm still alive and having this conversation with all of you today. So in 1991, I didn't have all the resources and research out there, and I had to patchwork it together myself and completely leave the construct of what standard of care could offer because I was sent home to hospice. There were no options. I was far too ill to even receive one treatment of cancer because my organs were in complete failure. I was on death's door. And so when you're given no opportunity, for me, I didn't expect to heal. I didn't expect to survive. That was not my intention. My intention was one of curiosity, of understanding why. And that's what's informed my journey. So I stumbled upon that at that time, the book that was published in 1962, Rachel Carson's Silent Spring. That was my first understanding in 1991 of the possible implications of an environmental impact. It took another 25 years for me to learn the EPA Superfund sites that I was living on or near in my early age in Wichita, Kansas, near multiple industries and multiple bases, et cetera, 7 EPA Superfund sites near where I grew up. It was not until I was in medical school in 1996 that I started learning from the now deceased and dear friend and mentor, Dr. Walter Crinion, an environmental medicine specialist who also co-authored a book that came out in 2019, right not too far before his death, with Dr. Joseph Pizzorno on environmental medicine, which is the textbook now for environmental medicine. I also had the opportunity in 1998 to study with also the late Dr. William Ray out of Texas. We have environmental medicine today because of this man and his work. My mentors in the fields of, now we have several organizations such as NAEM, which is the Naturopathic Association of Environmental Medicine, as well as the American Academy of Environmental Medicine, of which I'm members of and go to their conferences and present to their conferences and getting ready to go again in 2022. There's so much, it's like watching it just bloom and explode at a time when it just simply didn't exist. And I'm always just thrown off the fact that there are still so many people out there in the world that are not even aware of what it is that we're actually being exposed to today. It is very, very hard to be healthy on a very, very sick planet. And to me, you cannot be a doctor today in general, or an expert in oncology if you are also not an expert in environmental medicine. And so that is part of what we train our physicians in. It is definitely the blueprint of what we hope to build. I love the Walton Foundation Center because it gives me inspiration as well to see that we're starting to drop this into our world, at the very beginnings of our life. So yeah, we've come a long way, but we have a long way to go.
Right.
Yeah.
Michelle or Joan?
Yeah, I'll piggyback off of that. I think as a layperson that we assume whatever's on the shelf must be safe. And I think it was very shocking for us to think that children exposed to certain products or their living environment or what is surrounding their home could lead to forms of cancer. And it was shocking at best. And I think that's why we were so early on in the design process that it really gave us a chance to slow down and really think differently about this project versus building another standard campus and outfitting it with more unhealthy materials. And so we appreciated the fact that we had a couple of extra years in there to really, put the brakes on and begin to think differently. And I think experiencing it with 2 children in our program and hearing it on a day-to-day basis of what these children are battling, what their family is having to endure. And then to Dr. Winters' point is that after the fact, when the family goes home, what next? How do we begin to shift our environment? How do we think about materials and food differently? And that really resonated with me. Years later, we're pleased that we've taken the painstaking time to think about what we put down at a child's level. And I'm sure many people on the call today may have young children, and we know that they're down near the ground. They'll walk up and lick a wall. Why? Because they can, and they're experiencing everything through their mouth. All their toys and materials going into their mouths. And this was our opportunity to make sure that as they're experiencing their world, that these are the healthiest materials that we could possibly put in front of them at this point. I think we do have a long ways to go. Like I said, we spent years researching products, looking at labels, asking the hard-hitting questions of what makes up this particular product. And oftentimes people didn't want to disclose. So that was an instant no for us. And we just, we need to become more educated, especially parents of young children, so that we can start making more informed decisions about what we're putting in front of our young children.
Joan? Oh, you're on mute? You're on mute?
Yes, I got it. I would say after the diagnosis for my son, I kept asking the oncologist, how did this happen? What caused it? I did not get, it was environmental. I got a medical explanation, but still in the back of my mind, I had to have an answer. Like what was causing him to have cancer? And so I thought he served as a lifeguard during that summer. And I thought, was it the chemicals that he had to put in the pool? I looked at the food, what could it be something that, he was eating? I was trying to analyze everything. I even looked to make sure that we weren't living, near a toxic chemical plant. I searched the EPA to see if there was anything that was recent, close by. There was nothing. So I felt like I needed answers and I wasn't getting any of them. So it was very frustrating. I took chemicals out of the home. I, tried everything I could to make his environment, healthy, but I just didn't understand like what had caused him to become sick. I just had a feeling, could it be environmental? I don't know. The other thing is I thought he was playing ice hockey. Could it be something that they added to the ice Could it be in the clothing that he was wearing to play hockey? Because you have these big, pieces of clothing on you. He was playing lacrosse. Could it be something that was sprayed in the grass? So, I never got any answers, but I just had suspicions that it could be something, chemical related.
Well, it is, the world we live in is as we all have had wake up calls, it's way more toxic than we ever expected. And so it's an accumulation of all of these exposures. And that is the tough part. We just now starting to want to find more data and more answers. And I think, that's where we're headed. And I think Nasha, with your institution that you're creating, you're it's more than an institution. It's a really, it's a health, wellness, and regeneration center. And I think you said that I might misquote you, but something to the effect that, we're all have this, we all have the potential, right? And to have cancer, but it's just the exposures that, and again, I'm not quite getting the quote, but you have a great quote. Does that ring any bell? That
does. It's like we all have cancer cells all the time, all of us, every one of us, those little things that are born into this world as well, preconception as well. It's the accumulation, it's the drops in the bucket that accumulate, and our own kind of personal blueprint that interacts or interfaces with that. We all have a different sort of genetic and epigenetic tolerance, if you will, to these exposures. And to Joan's point with her son, the thing that also didn't exist 30 years ago, 20 years ago, 10 years ago, and even maybe 2 years ago was our ability to really test these exposures. We can now take blood, urine, tissue, saliva, samples to understand what it is exactly we are being exposed to understand our own personal thresholds, and to have some awareness and start to create as I said, that test, assess, address, don't guess, to understand the why, so we know the how to change the course of things. And that's what I think is really different and unique, and that we've kind of been doing our best guess, but technology and testing is catching up with us. And so I feel really hopeful that we know that data is more compelling. We're a data-driven culture. And I think that we might make some bigger change if we actually can gather that information. And I saw a question come through about like the studies. I read those studies avidly, and Andrea had written here about the published study on lung cancer, cancers and exposures to things like fragrance and other solvents in our environment. This is huge. I mean, fragrance is more toxic than cigarette smoking. And even a study came out last November about GBMs, glioblastomas, the most aggressive brain tumors there are, and its impact from air pollution. So these are the things that we are underestimating. We were talking earlier this morning about the exposures our young adults are now seeing, and the explosion, as you read, those horrific rates of childhood cancers increasing. We're also seeing a younger and younger age of young adults getting cancer. Cancer used to be the disease of the aging, the elderly, and we're seeing the fastest growing rates of cancer in young people today for colorectal and brain tumors showing up exponentially. So it's just incredible. We need to do more. We need to understand more of the why, which might compel us to do something about it. And that's what I'm hopeful for. So, yeah.
Well, great. Well, let me ask you each this one last question. Hold on. And then we can open it up for questions to the audience. I was going to share with you the screen. I should put that up now of call to action everybody can take, and we can share that with everybody that joined as well. But sort of the general question for each of you is, how would you like to see your respective fields, one being in the oncology field with Nasha, early childcare industry, Michelle, and the financial world wake up as well to the rising rates of pediatric cancer, and how by raising awareness and bringing them into this discussion more, we can all prevent the further escalation. So just some thoughts on how that could happen. Anybody want to?
Yeah, I can see it in my field, in the investment field, of investing in companies that are, very aware of the environmental impact, because, we want everybody to live in a safe environment. And I think if we continue to invest in companies that, are damaging the environment, that's just going to make things worse for our children and future generations. So I think if companies can be more aware of when they're looking to invest in companies, that would be great, to look at the environmental impact that, of the investment that they're making. And I think also, maybe it's also more collaboration between all these organizations that are doing research into cancer. I feel like so many organizations do it in a silo effect, that if there's more collaborations, even on a global basis, that would help bring cures faster.
Great. Nasha or Michelle? And I also want to apologize. I was trying to bring up a slide, but I don't think I can find it with a call to action. Seems not to be there, but Nasha or Michelle?
Well, I think mine, I've kind of spoke a lot to it, I think, throughout this, but the thing I get excited about is seeing what Michelle's doing. And I want her to speak to this. Is I also want to do more work with preconception care. Like, she's doing early childhood development, but I think we need to start assessing the health of our fertility and what we're passing through, because we're basically 3 generations in one woman. And we want to be able to change that up, that we have to start even before our children enter this world of the evaluation and the cleanup process. So I love the early childhood piece, that is definitely helpful, but I think we also have to start focusing even before then to get this cleaned up. But that's just my 2 cents of, I'd love to see an entire field of early or preconception medical care start up as well.
Mm.
Hi everyone, I'm really sorry to cut in. We really have to wrap this up quick, because actually we have another CCPI webinar in exactly 5 minutes.
Okay.
I'm really sorry to have to cut you off this way, but thank you guys so much for coming and listening in today. And for the call to actions, we will send a follow-up email with all that information for you. So if you just want to say a few closing thoughts, that would be good.
Sure. I just want to thank each of you and for the incredible work you're doing in your respective fields to break the mold and really create long and lasting change that will benefit the health and well-being of current and definitely future generations. It's definitely needed. So, and also thanks to American Sustainable Business Council and Davika, thank you so much for your help on getting this webinar working, but just in general. So yeah, well, hopefully we'll send you out the call to action and continue talking later. Bye.
Bye.
Bye.